Hi, my name is Ashton Gatewood. I am a second-year medical student at the Oklahoma State University College of Osteopathic Medicine at the Cherokee Nation campus. Today I would like to present to you our research project, Native American Student Perspectives on Tribally Affiliated Osteopathic Medical School Education. My co-authors are Rachel Terry, Dr. Natasha Bray, and Dr. Micah Hartwell. Since this presentation is being done virtually, I've included an image of our poster for those not able to make it to the in-person poster presentation. During this virtual recording, I will be going over each section of our poster and we'll conclude with a slide over contact information if you would like to reach out with any questions. As the first tribally affiliated medical school, Oklahoma State University College of Osteopathic Medicine at Cherokee Nation, from now on will be referred to as OSU-COM Cherokee Nation, presents a landmark opportunity for Native American students. Little research has been conducted regarding Native American students' sense of belonging in the university setting, and no research investigates this in the medical school environment. Students' sense of belonging is linked to positive academic outcomes, including higher grades, increased engagement, self-confidence, and acceptance. In addition to sense of belonging, documenting Native American medical students' perspective of culture, relationships, or closeness with their tribe, and what it means to them to be medical students in the inaugural class of a tribally affiliated College of Medicine is important to culturally sensitive, quality-focused medical education. Thus, our objective is to evaluate Native American students' sense of belonging at OSU-COM Cherokee Nation through a sense of belonging survey, interviews, and essay responses through this mixed method study. A social constructivist approach was used to put together qualitative methods to gain an understanding of medical students' perspectives on sense of belonging in the inaugural class. Data were gathered via mixed methods using a sense of belonging survey, semi-structured interviews, and essay prompts. Participants were recruited from a sampling of all medical students in the inaugural class at OSU-COM Cherokee Nation, identifying as tribally enrolled or tribal descendancy alone or in combination with other races. Participants were recruited through emails advertising the recruitment event, an in-person recruitment event with virtual option, and follow-up emails to schedule the interviews, as well as for them to turn in their paperwork for the surveys and consents. This is a copy of the Sense of Belonging survey showing that this survey provided a scale that contained qualitative as well as quantitative measures. We were able to collect this information from all participants involved in this study. Surveys were collected electronically and hard copy, followed by interviews recorded via camcorder for transcription with Rev out of Austin, Texas. Thematic analysis was conducted using Braun and Clark's 6-phase framework for doing a thematic analysis. Step 1 requires the researcher to become familiar with the data. 2, generating codes. 3, searching for themes. 4, reviewing themes. 5, defining themes. And 6, write-up. MASDAQ software was used for the data categorization and management in order for us to search for themes and generate codes so that we could also review the themes and define them. MH generated inductive codes with themes identified from the coded data. Next, AG and RT reviewed transcripts individually and coded the data separately. After all the coding of data had been completed, AG and RT came together to resolve any discrepancies until 100% inter-reviewer reliability was met. These are the results from the semi-structured interviews. We have 7 medical students meeting criteria for participation enrolled in this study. Data were categorized into 4 main themes: psychosocial and personal identity, which included personal affiliation, identity, or mental or physical health that affected students' learning, engagement, attainment, particularly stereotyping, stigma, and historical trauma. The second was Native American culture and heritage, family origin, heritage, participation in tribal ceremonies, oppression, stigma with specific notation of past, present, or historical oppression against engagement, community perception, tribe or community's change in pride or stigma over time in general or related to medicine, and tribal affiliation. Affiliation with first, the tribally affiliated College of Medicine related to the campus, faculty, or other medical students, community, and the importance of being tribally affiliated. So as I said, these are the results from our semi-structured interviews. This graph shows you the main theme along with the sub-themes regarding Native tribal culture and heritage. Themes under this category were past participation, present or medical school participation, and historical oppression within the family. The quotations taken for this section we believe were as a good summation and representation of the aggregate responses from all participants. Overall, students felt that it was important to participate in tribal activities in the past, as well as continuing that into their time at the OSU Calm Cherokee Nation. Many students also discussed historical oppression within family and pride in being able to achieve their status as a medical student and return to help their communities. This slide shows the data results from our theme, Psychosocial and Social Identity. Subthemes in this section included Native American, medical student, gender or sex, and tribal affiliation. Many of the participants identified as Native American or even specified identity with specific tribes. Other students discussed how becoming a medical student, especially at the Cherokee Nation campus, contributed to their sense of pride and belonging, and how they felt like that strengthened that connection with their communities. It was even mentioned by a couple of students, the fact that they were Native American and women and the impact that made on their perspective in attending the medical school. This graph shows the category community and tribal perception, how the subcategories broken within this section were change over time and view of medicine overall. A lot of the participants reported that their view of tribal membership and engagement in the Native community have evolved and changed over the past. Most reported that specifically within the last 2 years of didactic education at OSU Calm Cherokee Nation, their connections have been greatly increased. All of the participants discussed the opportunities to engage with tribal culture at the OSU Calm Cherokee Nation and how this has impacted their view of medicine and how they plan to practice as future practitioners. This graph reveals the sense of belonging category along with subcategories: OSU Calm Cherokee Nation campus, belonging related to faculty, belonging related to medical students, belonging related to the community, and importance of tribal affiliation. Students often discussed the artwork and the history available for viewing at the OSU Calm Cherokee Nation campus, along with support from the faculty and their peers. Students also discussed the family atmosphere and feelings of belonging with the community members in the town of Tahlequah, where the school is located. Tahlequah is the tribal headquarters for the Cherokee Nation of Oklahoma and adds to the diversity as well as the culture experienced at the OSU Calm Cherokee Nation campus. Many students reported that their importance of tribal affiliation had increased while being at the OSU Calm Cherokee Nation. Some even reported interest in returning to their tribes to serve as physicians upon graduation. These are the results in aggregate from the Sense of Belonging survey. We took the qualitative scale from the Sense of Belonging survey and assigned numerical values from 1 to 5 for each of the categories, and then averaged those within each category between all the participants. We had a 100% response rate from all participants, So the averages were reflected across all 7 participants. For this category, the highest scoring categories at 5.0 out of 5.0 were: how happy are you with your choice to be a student at OSU Calm Cherokee Nation? Extremely happy. How much respect do other students at OSU Calm show towards you? Completely respectful. And how welcoming have you found OSU Calm to be? Extremely welcoming. The lowest scoring category at an average of 4.14 out of 5.0 was: how much do you matter to others at OSU Calm Cherokee Nation, which was mattered quite a bit. While this is the lowest scoring section, it is still relatively high, as both of the highest scoring and the lowest scoring sections were within the top 2 possible choices for respondents. This is the first study exploring Native American medical students' perspectives on sense of belonging at a tribally affiliated medical school. So we found that in our study, OSU Calm Cherokee Nation is facilitating a cultural environment for Native American students' academic success. Strengths of the study include concordance with previous studies found in university settings that sense of belonging can increase success as well as engagement. Limitations to this study include overall sample size. While we only had 7 students participating in this survey, that was a majority of the total Native American students on campus, as this campus only has a total of 52 students in the inaugural class. Future promotion of exclusivity for students without proof of tribal enrollment or those identifying as multiracial could expand benefits. While there is ability for all students to participate in all culture activities, it can sound like some activities are only geared towards students who can identify with either tribal membership cards or certificates of degree of Indian blood cards. So sometimes some of the students reported that they weren't sure if they were allowed to participate or not if they have tribal descendancy, but they're not a card-carrying tribal member. Further research is needed to determine the significance of interventions for academic medicine milestones. This includes performance on board exams and matching into residency. In conclusion, we found that an increased sense of belonging related to Native American heritage, importance of bridging past and present cultural involvement, and positive changes in personal and community perceptions of Native American culture and medicine were reported by all participants during this study exploring Native American medical students' perspectives of sense of belonging. Personal and community level importance for tribal affiliation for sense of belonging and success in becoming Native American osteopathic physicians were reported by all participants, as well as an increased level of importance on tribal affiliation during their time at OSU Calm Cherokee Nation. We would like to give special appreciation in our acknowledgments to the Oklahoma State University Department of Research for an internal seed grant of $25,000 to fund this project. I'm the presenting author with my contact information on the slide as far as email, and we have a second student contributing author, Rachel Terry, with her contact information as well if you would like to reach out with any questions about our research project. Thank you.